Okay, so today we're gonna show you how to do a blister. So if the blister happens like on the field or like during a game or a practice or something, you're just gonna like you could use hydrogen peroxide or betadine to just like to just like clean the outside, just like clean it up like you would a regular wound and like make sure it's covered and everything. But then once you get back in the training room, you're gonna need some supplies. So you're gonna start by sterilizing, you're gonna need scissors and these little like forceps, and put them in the isoquin for like 5 minutes to clean and sterilize them. And then you're gonna need like gauze, tongue depressor, and the antibiotic ointment. But today we're gonna use this because we're just practicing. Okay, so to start, you're still gonna clean the blister. But so you only use this hydrogen peroxide if the blister has not been broken, like if it hasn't before it's like popped or anything.
We'll do the betadine. That's fine.
So yeah, okay. So we're gonna clean it with the betadine and the gauze.
And we should clean all around the surface.
You just wiped off the marker.
That's okay. That's okay.
It's okay. We can see it. It's fine. The blister is still there. Okay. So then, and then after, make sure that these have been in there for long enough. We're just gonna pretend today. So then you're gonna dry it off.
No, you don't.
And then you're gonna or take these out and shake them out. And so you're gonna wanna. Do you wanna go?
Yeah. Okay. So first, you're gonna want to grab the blister, right? That's first, right? And then it's a little tricky. And you're gonna cut a little smiley right in the center of the blister. But first you have to grab it.
And you wanna, that's one of the harder parts. You're gonna wanna try as hard as you can not to touch so like in this case the table, so like you don't wanna touch like the underneath part of the blister, because that's gonna hurt really bad.
Okay. It's gonna take me a little while.
Grabbing it is really hard once you get it. So then you wanna cut a little smiley face around the edge so you can open it up.
Alright. And we're gonna cut smiley. And you don't want to, when you're trying to grab the skin of the blister, you don't want to, make sure you don't touch the inside.
Just make sure that your smiley is big enough so you can lift it up and like make a little flap that you can open up to see the inside of the blister.
Alright.
So, wait, come a little farther so we can like actually pull it out.
Alright.
Okay, so once you have your flap open, you're gonna get this tongue depressor out, and you're gonna put. Here, I can hold this for you.
Alright, yeah. Oh, okay.
I can do it.
Yeah, so it's best if you probably have 2 people living out here, but not necessary.
So you're gonna get the tongue depressor and put the antibiotic ointment, or like we're using petroleum jelly today, and you're gonna put it on there. Yeah, it's a little much. Just a little bit. And then you're gonna put it on the inside of the flap. So just don't wipe it on the skin, because it's like on the underside, you're gonna put it on this flap. So you still wanna try not to touch like the bottom part, or like the table in our case.
Yeah.
So once you have it in there, you're gonna close it up. So see, we put it inside the flap. And then after this, you're gonna cover it like, Band-Aid, keep it clean and covered. So like we would put like Band-Aid, wrap it up and stuff.
Yeah. And then with the blister, you want to make sure you come in the next day to get the dressing changed. And Keep it clean and covered. And
Or yeah, so we'll
everything, yeah.
continue to keep the flap on. So you don't want to take the flap all the way off, like, and expose the underskin. So you want to keep the flap on it until the skin underneath isn't red anymore. So like until like the bottom part of the blister isn't red anymore, and it's like gotten to a more like pink, healthy, less angry color. So you want to make sure that the flap stays on as long as possible to like keep it clean and covered.